Where do your clients usually access health care? Like, do they have a family?
Majority of them do have family doctors. They have doctors who are, if they're HIV positive, who are specialists in that area. And we're fortunate in the city of Toronto that we have some doctors who specialize in that. So, but a lot of the, I would say, more people on the streets or who are more migratory back and forth in and out of the city don't have family doctors.
The ones that are not positive probably are less likely to have a family doctor.
That's true.
And they'll be in and out of like emergency rooms or walk-in clinics or something like that. And that's from a long history.
One of our members went to a doctor for his appointment early in the morning prior to going to work. So when he got there, he got seated and announced that he was there, and they just said, have a seat. So a nurse that was not regularly there took him and started taking everybody else before him. And all of a sudden, he walked up to her and said, well, why have you been taking all of these other people ahead of me? Because I have an appointment that was scheduled for like early, like 9 o'clock or whatever. And she explained, I said, oh, I thought all of these other people were on their way to work. My experience last year, I think, on my deathbed was that we brought in our two-spirit drum, we brought in sage and sweetgrass. I'm teaching the healthcare professionals, nurses, doctors, orderlies, and all the staff about who I am as a two-spirit person, and bringing into that the cultures, the traditions, and the ceremonies, and teaching them how my health is affected by not only the Western medicines that they were able to provide to me, but the spiritual and community support that I got from the two-spirit community people that came to see me while I was gravely ill, plus the support of my family. So I think, you know, when we talk about holistic health, and when the healthcare providers need to understand, is that if these sacred objects and medicines are in hospital settings, that it's fine to ask, you know. I think a lot of them just started asking questions. What is that thing over there? You know, I said, that's our drum, that's our two-spirit drum, that's our responsibility to keep that. That is sweetgrass, and it's...
And you were really sick and you were explaining all that?
Yes, I was, yeah.
Very typical of him.
Very typical of me, of still educating healthcare professionals. And when they had that understanding of who I was, they were just like so pleased to provide that care, and it was a good experience for me. But I had to make that extra step. Yeah.
Well, there's a key example, a very dear friend of ours, we won't mention any names, but he was out partying and he went home and he slipped on his rug and he broke his leg. And he knew from having been in the health professions that if he showed up with a broken leg, still a little bit drunk, he'd be treated very badly. So he waited till the next morning to go. And that happens a lot. We've had clients who were sitting, you know, maybe with dementia, maybe just really, really sick and really shaky from HIV or AIDS-related issues. And what was the nurse said? Look at that dirty little Indian over there. And how many people, I mean, this is not a really high income area when you move in a little bit east of here. And how many people they had experience with it. They didn't learn a little bit more sensitivity and understanding around some of the issues facing the community in this area, right? And so anything to do with drugs or alcohol, a friend of mine was gay bashed very, very badly. And he lost consciousness for a bit. He was bleeding and he was staggering down the street because, as it turned out, they had crushed a couple of vertebrae in his neck, so he was like off balance. And nobody stopped to help him. Fortunately, he was bashed about a block and a half from Wellesley. And so they just assumed he was drunk. But I mean, the guy was bleeding and he didn't have any shoes on or anything. It was awful. But that's the kind of attitude. And considering it's in this kind of neighborhood, you think you would get some understanding of the issues and be able to cope with it. Now, one of the great places is on Sherburne Street, the health clinic there. They, on the other hand, have a fabulous attitude and deal with people. Like, they'll negotiate with people. If you're using drugs, they'll sit down with you and say, I can't get an informed consent from you if you come in after you just shot up. So can you like shoot up earlier and then come in.
Yeah.
Stuff like
Wait till
really
you're done.
reasonable, practical,
Harm reduction.
solutions.
Harm
Yeah,
reduction, yeah.
yeah, really good stuff.
So people want to go home to be closer to their families when they're able to do that, and the ignorance that they come against is just, I don't know. It's like I heard some horror stories of people going home and band councils totally isolating these people, saying you got to stay in your house, like you can't come out, and like. And they kind of, but that was around the time that there was SARS in Toronto, so they kind of said it was SARS that you have to stay. But the rest of the family could go out, and they were in Toronto at the same time. But that person had to stay locked up in the house. And people who go home in smaller towns and cities, there isn't a doctor that is specialized or knows what's happening. And
well, there was a friend of mine who has since passed on, and he wanted to move back to his community. In order to do that, his health was quite good, and he was very strong at that point. So even just that fact of being strong enough to go home and be there was a good step and a healthy step for him. But as his illness progressed and his health started to deteriorate, he soon realized that what he was actually doing was that his doctor was not knowledgeable about the disease that he was treating him for. So as his disease got worsened, then he had to move back to the large urban center again, to get the appropriate medical care. So that's just one example of.
I would tend to agree. That's why there's that migratory. Like people need to come back to the city for that care again.
But one thing, I'm one for language, and the language that medical professions, whether they're nurses, or whether they're the people taking the information, or whether they're the doctors who are seeing me, it's very violent. We're going to be aggressively attacked. Well, this is part of me. Don't attack me. I've had history of being attacked through all these plagues. Change the language. Treat me more than just a file or a stack of papers. It might be my kidneys. Don't tell me it has something to do with my appendix, because you took that out in 1990. Because I know my body. So just, I may not know the big Latin medical terminology for some type of system in my body, but I have an idea. I'm in touch with my body, and I just need some guidance.
It was all very physical with doctors, right? The very scientific, physical approach. Even doctors are starting to realize that looking at the whole person helps. So that is a value of Indigenous Aboriginal peoples throughout the world. Very holistic approach to your health. Let's get over this, the stereotypes and the mythologies about us, and start to value some of the things. I mean, we existed in this continent with our traditional medicines and our belief system for thousands of years without cancers and without all sorts of things. So there is a whole wealth of scientific knowledge that's embodied in our elders and our healers and in us. So respect it, learn from it. You can't lose.
But I'm listening more with just my ears and seeing more with than just my eyes of how we should do things and where things should be. Now, if you outstretch your arms, that's one way to do things, or this is another way. But if you move them just a fraction, those are other options. That's empowerment. And they come together and meet, that's one dimension. And if you think physically, that was 100 options there. If you think spiritually, of options of things to do, that's another 100. And if you think intellectually, that's another 100, right? So just listen more with just than your ears, and see with your eyes, but with your heart and your spirit.
Traumas affect people's bodies long term, and you can't just look at their symptoms, but you have to look at their traumas and how even their emotional being has affected their well-being too.
When you're working with the people that you work with, look at, as I said, look at the whole person, but look at your whole person as well, and take care of yourself, because you can only do the best work you can if you're looking after yourself as well.
Everybody has stated that everybody's life is important, and with that is the respect and the honor of that individual. So when people come in with their own biases or their own prejudices, that interferes in one's health care. So they can probably learn a great deal from us still from in the future, because I think what we've had to learn as a community is we've had to learn to deal with those biases and prejudices ourselves. And almost one of our Two-Spirit elders once said, we're at a point in our history in Aboriginal communities where we are now going back to pick up our bundles. So now we are the teachers, and we are the ones that are showing the way for the next generations to come. And so that's how I look at healthcare, is that if as we become stronger as a community, then we will be able to provide and contribute back in a more meaningful way